And one way that all of oncology is changing is trying to understand the genomics of the tumor and walk us a little bit through the mutations that are commonly seen in anaplastic thyroid cancer and kind of how we get those mutation profile as well.
Yeah, so you can see on the bottom right of that figure there, the most important mutation in pretty much all of thyroid cancer is in this gene called BRAF. And the canonical or classic mutation that is identified driving these tumors is called the V600E mutation. It's present in the majority of papillary thyroid carcinomas and a significant, substantial minority of anaplastic thyroid carcinomas. And this tumor is an oncogene that drives this rapid tumor growth, though anaplastic thyroid carcinomas often have additional mutations too. And the most important thing about this mutation is that scientists smarter than me developed an antibody that allows us to actually visualize tumor cells that have this specific single gene mutation in BRAF under the microscope. And so this is always the first step that we do in a patient who we're concerned has anaplastic thyroid carcinoma under the microscope. We will order this test to determine whether or not the tumor cells express this protein, this mutated protein. That said, it's also very critical for us to analyze other genes in most patients. So the BRAF immunohistochemical stain that we can do on the initial biopsy sample, usually, again, a core needle biopsy is usually better because FNA is often non-diagnostic or insufficient for additional testing. The BRAF stain that pathologists can do usually has a very quick turnaround time within a day. That said, in order to do the sequencing to identify other mutations, there's an additional molecular testing modality called next generation sequencing, which can perform DNA sequencing of many, many genes for mutations to, again, potentially identify something targetable, but also just to, sorry, but also to help confirm the diagnosis or again to confirm BRAF mutation status in the event that the pathologist stain is equivocal or challenging to interpret.
Yeah, that's great. And I think this really goes back to the point where an FNA is insufficient to do next generation sequencing, and that's where a core biopsy again can be really helpful. So thanks, Stephen, for that.